So it's time to answer your dental questions. Dr. Sean Moriarty from More Smiles is joining me this morning, and we had a lot of people chime in on Facebook. We're going to answer some of their questions. And Will says, I see a lot about oil pulling. Now, is that something that the dentists, how do they feel about this practice?
Well, what oil pulling is it actually originated in India. It's an old folk remedy, and it appeared in early Ayurvedic texts. And basically what it is, it involves swishing with some sort of oil, typically sesame oil, because that was back then, that was what was most available. And the idea is to kind of swish for about 15 or 20 minutes, and that's supposed to reduce the amount of bacteria and toxins in your mouth. So there has been limited amount of research in this subject. There's been a few studies which have shown it reduces the amount of bacteria that cause gingivitis and the bacteria that can cause cavities, but the jury's kind of still out, and there really hasn't been enough research to indicate that if it's really overall effective.
Okay.
There's also other things that you can rinse with that are, dental products that you can rinse with for a minute or two rather than doing that. So, from a homeopathic standpoint, it can have a limited use, but I think overall, you still got to brush and floss your teeth.
Absolutely. That's probably the best answer at the end of the day. Now, Lisa, she has a pretty good question here. She wants to know why so many x-rays?
Yeah, so this is a question that, I get every day. It's very common. So basically, x-rays, they tell us, they'll give us kind of idea of things that we can't see on our clinical examination. They're also good in order to kind of document and see what's going on. So if there's any changes, we have something to compare it to. And a lot of times, if we do any kind of treatment to the teeth, x-rays are required by the insurance companies in order to document and process claims.
Right, and you have different kinds, right? You have to get the front, you have to get the bite wings. So there's all different kinds that you're kind of looking into on that.
Right, and I think really the question is too is, are they going to be harmful to me, or with the amount of radiation? A lot of times with adult patients, we'll take a full mouth set of x-rays, which involves about 18 x-rays. And a lot of people are concerned with the radiation. What people don't seem to know is, you get background radiation from the solar system and, just kind of being alive, being on Earth. So, the amount of radiation that you're exposed to is about the equivalent of being outside for about an hour for a full set of 18 x-rays. So 1 or 2 x-rays isn't bad. We typically only take the full set every 3 to 5 years anyway.
Right.
So, and now that we have digital x-rays, they're like 1/10 to 1/12 of what the old x-rays were before as far as radiation is concerned. So they're safe, and no need to worry.
Definitely needed to document, correct?
Yep.
And Blaine also wants to know, why do wisdom teeth normally get cut out? A lot of us have to go through this.
Yeah, wisdom teeth, a lot of times they need to get cut out for a couple different reasons, but basically when the wisdom teeth come into the mouth, a lot of times there isn't enough room in the mouth. Also, if they come in at like an off angle, or they come in and they grow sideways, the oral surgeon needs to go in and basically expose the tooth in order to gain access to it. So usually they need to remove soft tissue or a combination of soft tissue and hard tissue in order to get to the tooth, in order to take it out of the mouth.
And I know in my case, you've had braces before, right? I mean, you don't want to sit here and if they come in, knock out your teeth that are already aligned, correct?
Well, that's actually a fallacy. So
really?
wisdom teeth do not cause the other teeth to shift or move. It can be, from other things, but typically, that doesn't happen.
Oh, well, see that? I even learn something new every day. Dr. Sean Moriarty, thank you so much for joining us here. And don't forget, if you want to ask him a question, head to our Facebook page.
The investigation into the crash of Malaysian flight MH17 takes a major step forward. I'm Kelly Wright. More on this story coming up.
And look at some of these numbers out the door this morning. 60, 66 in Lebanon, Lancaster at 68, Harrisburg